The human hand is a marvel of mechanical engineering, but when arthritis affects the joints, every movement can be painful. According to Dr. Andrew Wong of Redlands Community Hospital, there are treatments available to help with the pain and the stiffness.
The hand's very complex, and I think it's just absolutely fascinating, the amount of anatomy that really fits into such a small space. And I look at it kind of as an extension of who we are. It's really the way that we can, reach out and change our environment. Whether your passion is working on old cars or doing painting, sculpting, cooking, all those things really require our hands. And the amount of detail that we can get, the fine precision that we can get is just amazing. It's made up of a bunch of smaller bones, very delicate structures, tendons, nerves, and it's really a really complex and elegant structure.
We asked Dr. Wong what kinds of problems there are with the hand.
There's a really wide variety of reasons that people come to the doctor for problems with their hand. And probably the most common reason that everyone's probably heard of but maybe doesn't know a lot about is called carpal tunnel syndrome. And that's squeezing of a nerve as it enters your hand. It runs through your wrist. It helps power some of the muscles in your hand, but also gives you sensation in your thumb, index finger, middle finger, and half of your ring finger. So with carpal tunnel syndrome, what happens is it runs through a tunnel that has very confined space. It runs along with some tendons that help motor your fingers, and with compression there, with swelling there, there can be pressure that's placed on the nerve. Over time, that compression decreases the amount of blood flow that the nerve gets. That can cause some scarring around the nerve, decreasing the nutrition to the nerve, and that can cause problems long-term with the nerve. There can be a lot of arthritis, and unfortunately, arthritis of the hand seems like a little bit of a genetic thing. So a lot of times, very often, women will say to me, I somehow ended up with my mom's hands. And so I think that's what happens. It's an accumulation of damage over time, but some of us are just genetically programmed, unfortunately, to get arthritis in the fingers. And that can occur really at any joint in the hand.
Dr. Wong told us about some of the more conservative treatments for the condition.
So arthritis of the small joints of the hand really is a big problem. There's things that we can try, like medications by mouth, anti-inflammatory medications. And there's little therapy modalities that we can use. Sometimes just dipping them in paraffin wax, a hot wax, can really take away a lot of that burny, achy kind of pain in the fingers. So those are some of the more simple things. Beyond that, as arthritis gets very bad, in certain joints we're able to do joint replacements in those as well. And it depends on whether or not you're a good candidate for that, what kind of demands you put on your hands, and what kind of arthritis we're dealing with. As you get out to some of the smaller joints in the hand, really those, we don't have the technology yet for very good joint replacements for those. And the solution to a very painful joint in a finger can be just to fuse the finger in a functional position. And that can take away pain very reliably. It can also put the finger in a position that can still be used very well and with delicate activities too. But in general, surgery of the hand is very successful. There's a lot of maladies of the hand that we don't have a good answer for, but the ones that we decide to do surgery on and that we counsel patients about usually are very successful.